This is the dynamic movement analysis and movement assessment, and we're gonna check how Barbara is able to go from a seated position to a standing position. We're going to perform 5 reps, Barbara, and what I will ask you is to keep a normal breathing pattern and do as you would normally do. You can go now. Yeah, perfect. Good. Good. I will ask you to perform a couple of reps looking to that side, so we can also see from the sagittal plane. 5 reps as well. Good. Excellent. 2 more. Good. So one of the few things that we could see from the frontal plane, first of all, is that Barbara was able to keep the stability of the arc of the foot. And that is actually very important because it's a good indicative that she's able to create force through the chain and also keep the tension and create tension from the foot all the way up. That is going to ensure that she's going to have a strong position on the knee, and she's going to have stable position as well to push from the floor and hit and generate force. Can I ask you to move to the front? The other thing we could see is that Barbara was not using her arms, and that is very important because it's a good indicative that she has enough strength on her lips in order to stand up without having to use propulsion from his extremities. The third thing, and this is another very important thing to see, is that she didn't have a lateral shift of the hip while she was standing up, and that is actually great news because it means that she has a movement pattern that is coordinated. Fourth thing to keep in mind, and this is something we could see from the lateral side, from the sagittal plane, is that she was standing up and she was not shifting the weight to the front. She was not shifting the weight to the knees. And that is another important point in order to analyze the strength and coordination and motor control of the lower body, or in this case as a full movement body as standing up from the chair.